Welcome to the Tunbridge Wells Borough Council What We Do podcast. Today we're talking to the health team.
My name is Rebecca Bowers and I'm the Health Improvement Team Leader.
And I'm Mark Lawrence and I'm the Everyday Active Champion for Cranbrook.
What is your team responsible for?
My team is the Health Improvement Team. We support people to make healthy lifestyle changes. One You Kent is a big part of that, and that includes supporting people to eat well, move more, lose weight, increase their physical activity and reduce their alcohol consumption. So that's a free one-to-one service or group support, and it's either in person or over the phone.
My focus is essentially just the physical activity side of things. So we're encouraging people to be more active in whichever way we do with wellbeing walks and the Everyday Active campaign.
And so what's your day-to-day work like?
So as team leader, a huge part of my role day to day is about supporting the team. Within the One You Kent service, that could be supporting with referrals if things are particularly busy, also talking to advisors about the best way to support clients. In addition to that, it's about making sure we're meeting the requirements set by Kent County Council, so they're the ones who fund the One You Kent service. And this could involve setting up new groups, looking into new projects, either in the One You Kent service or wider in the health team. And also working with other partners is a really key part of it. So whether that's internally in the council, other departments such as housing, external charities or services, and that could include the NHS as well.
As I say, I'm the local champion for Active Kent and Medway's intervention called Everyday Active. It started out really me being embedded within the community, so I'm out community facing, speaking to people, trying to find out what the reasons for people not wanting to be physically active, or the barriers that cause issues, and trying to be sort of aware of what's available locally and trying to update that within our sort of Everyday Active website, promoting those things through the website and other resources. Most of what I do is to do with wellbeing walks, so I coordinate all of the Ramblers wellbeing walks locally, recruiting and supporting volunteers, helping to train them, keeping track of the attendance of the walks, publicity, website, everything else. I send out weekly emails about what walks are available, accessed a lot of funding from Sport England through the Together Fund, and set up new activities like parasize classes, Nordic walks and outdoor gym sessions with an instructor. Lots of going on.
So what kind of background and qualifications do you have to get into your kind of work?
So it really depends and varies on the role that you do within the health improvement team. So I, for example, have a psychology degree and public health experience because public health is a huge part of my role specifically. But within the team, we've got registered nutritionist, people that have been a personal trainer in the past, relevant health-related qualifications and degrees, including courses through the Royal Society of Public Health. Really, it comes down to the knowledge of health improvement, knowledge about behaviour change and that experience in motivating people to make those changes. There's such a wide variety of qualifications and experience in the team.
The council was actually looking for someone who is embedded within the community, has an interest in physical activities. Work that I do with the charity in Cranbrook started it all off, and I came in here, but since joining I've then gone on to do professional development in terms of the Royal Society of Public Health qualifications that I've done there. I've trained as a Nordic walking instructor and done some physical activity courses and things like that, so I was kind of brought in but then trained up.
Are there any other skills that you need outside of qualifications, soft skills sort of?
Yeah, definitely talking about the One You Kent advisors. Obviously I've spoken around behaviour change and motivational interviewing, so the advisors are working every day with clients. We're working with real people that have real behaviours that they want to change, so there's a huge part of it is empathy, understanding everything that is going on in someone's life, and it has to be the right time for them to change.
Yeah, like I say, just being able to create a bond with people really, and be personable is huge, and being friendly. So.
And the last question is my favourite question, which is, what is the most satisfying part of your job?
For me, it has to be seeing the outcome, the people that we work with. I really feel that we make a real difference to real people's lives. So whether that's someone that's come through one of our programmes and they've lost weight, or we've been able to connect them to another local service through signposting them, they've had great outcomes there. So it's those outcomes, and we see them as well through like testimonials and feedback that come through the service.
It is about those individuals that we meet. You know, a chap who has come through a cancer diagnosis and has come walking with us, and just through conversations with us, he's been able to boost his confidence and actually being able to air things that he wouldn't be able to air. You know, we'd be sitting at home stewing on them, and he's gone through that whole treatment plan and he's now in remission, and we've been able to support him through all that. It's really satisfying to know that, and actually he's a close friend of mine now, you know, so I really see them that way.